The new year is bringing some new laws that are going to help expectant mothers. Delaware and New York now require Medicaid to cover doula services. The state of Arkansas now requires healthcare providers to ask mothers if they want to be screened for depression in the first 6 weeks after they give birth, and requires insurance to cover the cost of that screening. Connecticut is allowing the opening of freestanding birth centers that will give more access to maternal health care. As laws improve, though, expectant mothers can also take matters into their own hands by improving their fitness. And that is where maternal fitness apps like Expect come in. Joining me now is Dara Cook. She is the CEO and founder of Expect, the only OBGYN-approved maternal fitness platform. My friend, Dara, good to see you. How you doing?
Great to see you. Thank you so much. And congratulations on this show.
Oh, my God. Me and Dara go way back in the TV business. But now you have moved on to do so many other things, too. Talk to me about this fitness platform. What makes this one different?
What makes Expect different is that we are the only pre and postnatal fitness platform where every workout is approved by OBGYNs. So right now in America, if you're pregnant, if unless your doctor has told you because you have a certain type of condition, your doctor will tell you you've got to exercise, right? So broadly speaking, the American College of OBGYNs is now saying if you're pregnant, you need to exercise at least 150 minutes a week, right? So it's joining the pantheon of eating well, getting your sleep, not drinking, not smoking as a hallmark of a healthy pregnancy. So we know that doctors are telling women to exercise. We know that women are wanting to exercise in pregnancy, but rightfully so, many don't know what is safe. Your body is changing, your center of gravity is changing. You hear about certain things that you shouldn't do when you're pregnant. So we take care of that. Expect is the only platform where we've taken every single workout. It's a streaming video platform. It's as easy to use as using YouTube. So you can work out on demand in your own home on your own time. And you know that every workout has been reviewed and approved by OBGYNs.
Wow. Expect is such an important sort of contribution here. What inspired you to create it? Why was it important to you to do it?
Yes, absolutely. So, right now it's a new year. Everyone is committed to their New Year's resolutions, and the number one New Year's resolution every year is more fitness. And me, I've always been a big fitness buff. And of all people, there's one group of people when they exercise, they're exercising for more than one person, and that's pregnant women, right? So they're exercising for the health of themselves and their babies. And there was a study that University of Michigan did that said labor, childbirth, has the same impact on the body as running a marathon. Now, who would run a
Wow.
marathon without training for it? Right. So even in New York City, where Expect is headquartered, you can't even sign up for the New York City Marathon without training for it, without proving that you've done qualifying runs, right? But unfortunately, every year, millions of women in America and across the globe are giving birth, running this very important marathon without training for it. And so that's where we come in. I decided, and Marc, we worked together in the past through TV, and I worked for years. I was the head creative of the MTV Video Music Awards and brand manager of Wild 'N Out, Nick Cannon's Wild 'N Out, and thought that we could bring entertainment grade production. We do it like we're doing it for TV. Shout out to Mace, to this world of pre and postnatal fitness. And in particular, this world, there have been solutions out there for pre and postnatal fitness, but they haven't been doctor approved. And honestly, they're not diverse, right? They're not showing the breadth of our body types, our racial diversity, and they're really, quite honestly, leaving Black women out of the conversation. And so we include all races, all body types. We even include men because a lot of times, if you're pregnant, there was a man around, right? So we include them in the fitness journey.
Wow, this is fascinating stuff. You mentioned your TV background, and I get the idea of saying I'm going to sort of make entertainment grade sort of content for this thing. There's still a shift, though, as a creative, as an entrepreneur, as a designer, as a thinker, as a business person. Was it hard to make that transition into this extraordinary industry?
It's such a great question. It wasn't a challenging transition. I think this is something that happens in with so many people. You get to a point in your career that you start to think about legacy and whether you are using your superpowers for good. And I got to a point where I said, I know how to make content almost in my sleep. And now it's time for me to make content to solve this really critical issue of maternal health. We're at a point right now where we're in a maternal health crisis. It is more dangerous to give birth in America today than it was decades ago. This is the reason why now the World Health Organization, the American College of OBGYNs, the US Department of Health and Human Services, they're all saying if you're pregnant, exercise 150 minutes a week. These old tales about being sedentary when you're pregnant, dead wrong. And I mean it when I say dead wrong. I mean it
I thought
literally.
that, Dara, I thought
Dead
that
wrong.
when my wife was pregnant, a couple years ago, I remember like being afraid for her to walk, do yoga, pick up a napkin. I was like,
Right.
something going to happen. And the problem was the exercise was actually helpful and healthy. And then it was a matter of trying to find an app or a program or some kind of content that would connect to us culturally, that would connect to our needs, our health needs, our cultural needs, our interests. Something that just wasn't corny. All the things, right? And I wish I had known more about Expect. But the good news is y'all out there, y'all can engage Expect right now. We're right here with Dara Cook. She's the founder and CEO of Expect. How can people find out more about it?
Yeah, so you can go to expect.fit, FIT. We're in the App Store, we're in the Google Play Store. You can check us out. And we have, to your point, we have an array of workouts. We have, if you're into hip hop dance, soca, we have pelvic floor exercises designed by physical therapists, approved by a urogynecologist. We do strength, cardio, we do mindfulness. And so we have everything that you're looking for in the app.
Y'all got all this stuff. Okay, y'all. Well, make sure you check it out. Expect.fit in them app stores. Make sure you check it out.